I want to talk to you about this case because as a former L&D nurse and someone who worked in maternal child as an educator and who has a specialty degree in women's health, we have to talk about sepsis and childbirth and the other added piece, the element of not feeling that you've been listened to. In June, Ravinder gave birth to a healthy boy, except the worst part, she didn't get to go home. Right now, the family is calling for better sepsis protocols in all of Ontario, but I think this should go further. Set a standard for all of Canada. So Ravinder's birth was routine. She had a vaginal tear that was a 2nd degree, and she delivered on June 19th. But within hours of giving birth, she started having shakes, a fever, as well as nausea and vomiting. The family even described that there was times where she had periods of confusion. The family also say that she had an elevated heart rate and some instances of difficulty breathing. In cases where sepsis is suspected, first line of treatment is typically antibiotics. It needs to happen promptly. But even with treatment, sepsis can be fatal. But in Ravinder's case, many hours went by without diagnostic tests or antibiotics. In the morning of June 20th, she complained of extreme pain and could not move her legs. Then the next morning on June 21st, her blood pressure plummeted. That morning, Ravinder spoke to Ravinder's sister, an ICU nurse who saw her vitals over a video phone call. When her sister saw the vitals, she believed that her sister was in septic shock. The family feels that their concerns were dismissed, even after her sister drove from Buffalo to see her. She was assessed by an infectious disease specialist at 4 who prescribed antibiotics. This is actually 29 hours after Ravinder's initial symptoms. By the afternoon of the 20th, her uterus and ovaries were necrotized, but the medical team focused on her leg as a source of infection. By June 21st, a hysterectomy was complete and her uterus and ovaries were removed. It was noted that her uterus and ovaries were completely necrotic, meaning that the tissue was dead. Ravinder was transported to a tertiary level center hospital where she died on June 23rd. When I worked in L&D, I remember advocating for something called a MUSE, so a maternal early warning system. When I worked in L&D, I used to actually advocate for something called MUSE, which is a clinical tool used to monitor patients to identify those that might be at greatest risk of postpartum complications. Why do we not have a standardized system across obstetrics and postpartum where we can identify the early warning signs in our patients? We need to do better.